tell us about B vitamins and how they're depleted by estrogens and methylation and all that kind of stuff. You're the expert there, Tammy. Tell us about that.
Sure. So when an oral birth control or oral contraceptive is started, the different nutrients that are depleted is folic acid, B2, B6, and B12. B vitamins that are really important that affect mood, can cause anemia when you don't have it. When you don't have enough of them. It can also decrease the antioxidants, vitamin C and E, and affect the minerals magnesium, selenium, and zinc. So we talked a little bit about magnesium and that effect. As far as selenium, that is actually needed for thyroid function. And so what selenium does is it's needed in regards to the thyroid. When you produce thyroid, you have a T4 and T3. T4 needs to be activated into T3 to exert its effect on the body. Selenium, when you're low in that, it cannot, carry out or have enough effect with the active form. So you need to supplement with that. And you can do that with like Brazil nuts or foods. And usually with the selenium, it's, you need about 55 micrograms per day. But the one thing with that, and going back to talking about the thyroid, is some people may have hypothyroid symptoms, but it doesn't necessarily mean they're not producing enough of the thyroid hormone. It's just not getting into the cell the way it's not getting converted the way that it should to then, like I said, exert that effect. Furthermore, with the magnesium deficiency, magnesium is actually, or potassium gets depleted when it doesn't have enough magnesium. So what happens with that is if you don't have enough potassium actually makes the cell permeable to let that thyroid hormone in. So you're kind of getting it two different ways, is you're not getting that conversion to the active form of thyroid, and then the cell is not opening up to allow that thyroid hormone to be affected. So some people may have the side effect of hypothyroid symptoms. The next thing is zinc. Zinc is another enzyme that's actually responsible for about 100 enzymatic functions in the body. So it's responsible for cell production and immune function. It's actually linked to the male and female hormone production. So zinc actually works kind of opposite of copper in our body. And we have copper in our body that actually is, it's an essential mineral. It's an antibacterial, antiviral, helps to maintain the immune system and nerve cells. So when we look at that in a ratio, because estrogens actually decrease zinc, when you have that decrease, then you have the opposite effect of copper. And zinc, let me back up, zinc is more associated with progesterone, where copper is more associated with estrogen. So when you have the zinc depletion, then the copper tends to rise up. When copper is really high in the body, it can actually become really toxic and can actually cause a lot of problems in the sense of psychological problems. It can cause actually PMS symptoms. So when we are looking at the cycle, women's cycle, about a week before they start their cycle, they have people who experience premenstrual syndrome. It's actually due to that copper toxicity because you have that rise in estrogen. And because you have that rise in estrogen, copper rises as well, and it actually gets into the tissues. So people can experience frontal headaches, depression, weight gain, food cravings, fatigue, constipations, and just that up and down emotion. Once that cycle is over and the estrogen comes down, then those symptoms tend to go down and the copper tends to go down. With the zinc, though, zinc actually, when we look at that, that ratio, then we have to kind of be looking at people who are on estrogens that have copper toxicity. So what happens with that is people don't really realize what the effects of copper toxicity is. I think, and maybe it's more me that I really came into that and found out for myself. I had copper toxicity because I had a copper IUD, but a lot of psychological things happen where people can be feeling apathetic, just depressed. They can be feeling anxious and having a lot of mental issues and not realizing that it's due to this copper. And usually, again, because you're taking estrogen, it's rising the copper in the system. When someone takes that the estrogen away, sometimes the copper doesn't always come out because it stays in the tissue. And if you don't have all your detox pathways to kind of clear out any toxins in the body, basically what happens, it'll continue to recirculate. And so I do a test for my clients. I do the hair tissue mineral analysis test, and I see a lot of people having copper toxicity. This is men as well as women, and it exerts a lot of negative effects on the body. This doesn't have to be just with estrogens. It can be people who are drinking out of copper pipes, who worked in mines, or have just that copper exposure. And so by detoxing that, you have to balance all your minerals in order to get that out. But I just wanted to kind of just put that out there, because I think that would be something for people to look into if you feel like you're having a lot of mental issues, or just feeling like depersonalization, to where you cannot really pinpoint what is going on with you. I would look up at coppertoxic.com. There's a lot of checkpoints. You could say, okay, am I experiencing this, experiencing that? If you feel like you're experiencing some of those symptoms, I would get like a hair tissue mineral analysis checked. If you get a blood level checked, it's usually not indicative of what is going on in your body, because your body wants to keep a normal level in the blood. So anything that's out of balance, it goes right into the tissue. And with the hair tissue mineral analysis, what that does is it actually looks at 3 to 4 months of metabolic activity. So if you have any toxins, not just copper, but it looks at all your vitamin mineral balances, and then even heavy metal toxicities, it helps to see what may be causing issues in your body that is causing you not to feel good. And then once you work with a practitioner who does that, then you can kind of work to balancing things out, working on your detox pathways to clear out those toxins to start getting you to feel better. But back to, I know I kind of deviated on that a little bit. But when you have low zinc, it's basically meaning you're having lower progesterone in relationship to estrogen. One thing you want to kind of look out for is being very careful on supplementing zinc. I think because especially the day we're living in, people tend to take a lot of zinc thinking, oh, I don't want to get sick. Let me keep adding that in. You don't really want to exceed about 15 milligrams per day. If you do have copper toxicity and you take more of that, that can actually release some copper in your body. And if it doesn't get bound up correctly, it can cause a lot of symptoms and then just keep recirculating. But yeah, I would definitely, on any supplements we're talking about, I've learned not to just blindly make a recommendation on, oh, you're low on this, take this supplement, because they all play a role with each other. If one is off, it can actually set off 2 or 3. So when you're able to look at your own personalized mineral pattern to see what's going on with you, then you can actually supplement what's needed to get your body functioning normally.